Lab diagnosis. For lab diagnosis, the specimen can be collected from the throat swab, and when you observe it under the microscope, you can see this club-shaped gram-positive bacilli with the metachromatic granules at the ends, which are stained by the Albert stain. We already studied this. So when you observe it under the microscope, this whole arrangement of the bacilli resembles the Chinese letter pattern. See, in the picture, this arrangement of the bacilli resembling the Chinese letter pattern. That is why we also call this as Chinese letter pattern arrangement, and Albert stain is used to stain metachromatic granules. Culture media. On the blood agar, you can see small white hemolytic colonies. Selective media is potassium telluride agar. So what you do, you take a potassium telluride agar and streak this Corynebacterium diphtheria onto it. Wherever this Corynebacterium are streaked, it gives a black color. The second picture you can see wherever the Corynebacterium are streaked, it gives a black color. And the first picture you can see this white hemolytic colonies on the blood agar. Identification by biochemical reactions, it is positive for sugar fermentation and negative for urease test. Automated is by Vitek. Elect gel precipitation is an in vitro test. Schick test is an in vivo test. Elect gel precipitation test. It is an in vitro test to detect toxigenic strains and the relationship between them. So once we extract the strain, we streak it onto the media containing antitoxin. The strain contains the toxin, we streak it onto the media containing antitoxin. So based on the agglutination, based on the type of agglutination, we can see the relations. See, if the strain is toxic, it agglutinates with the antitoxin in the filter paper and precipitation band is seen. If the strain is non-toxin, no agglutination occurs and no precipitation band is seen. So based on this, you can observe some patterns like crossover, spur formation and a fused pattern. In the crossover, the strains are unrelated. In the spur formation, the strains are partially related, and in the fused, identical strains are seen. To Schick test, it is an in vivo test. The test dose of antigen is given to the test arm intradermally, and toxides are given to the another arm. After 2 to 4 days, we see the result. If the result is positive, it appears like erythema and swelling, then it's a positive reaction. The person is positive for diphtheria. If it is negative, there will be no change over the skin. And if the erythema comes and then disappears, it is a pseudo reaction. If any combined reaction is seen, the person is susceptible to diphtheria. So what we do basically in the Schick test dose of antigen is given onto one arm. Toxides are given onto the another arm. This is about the Schick test and elect gel precipitation. So coming to vaccination, single vaccine is available where the diphtheria toxin is mixed with formalin to form the toxoid. So this toxoid is antigenic, but it is not virulent. It does not cause any disease. Coming to combined vaccine, it is available in 3 forms. One is diphtheria, pertussis, tetanus toxoid. Pentavalent, that is diphtheria, pertussis, tetanus, along with the hepatitis B and influenza, and tetanus and diphtheria toxoid. So administration according to NIS, total 7 doses should be given to the children. First, the main dose is the pentavalent vaccine, which contains DPT plus hepatitis plus influenza. So give this at 3 doses, right? At the 6, 10 and the 14 week. And after that, we go to trivalent vaccine, that is DPT, 2 doses at the age of 2 and 5. And TD, that is tetanus and diphtheria vaccine, which is also a booster dose, is given 2 doses at the age of 10 and 16. The site of injection intramuscularly given at the anterolateral aspect of the thigh. You can see in the picture, it is an anterolateral aspect of the thigh intramuscularly given, injected into the muscle. So the dosage for the children is 25 LF. For the adult, it is 2 LF. If the person gets the diphtheria, we can give him penicillin, azithromycin, erythromycin, or antitoxins can also be provided.